Hi, I'm Michelle Lewis with Siouxland District Health Department, and I am responsible for helping coordinate the Community Health and Needs Assessment and Health Improvement Plan for Woodbury County. And so on the screen, you see the 4 focus areas of our current health improvement plan that we're working on over the next 3 years. As a attendee at the Growing Community Connections meeting, the 5-minute update that is a part of that meeting, we provide updates on these initiatives in that 5 minutes. So for mental health, you've heard the presenters talk about different things that we're doing to destigmatize health, or trying to get a resource guide available for the general population and providers to use to refer patients with. Preventative health, we've done a lot of presenters on STIs, specifically syphilis, in the last few months because of the increase of numbers there. And then just the importance of preventative screening. So your annual, whether it's your mammogram or colonoscopy, or the importance of dental screenings or well child checks. Those things have been shared during our 5-minute GCC updates. Substance misuse. Again, we've talked about the diversion program within the schools, or things we've been doing with our maternal health population to get them to not be utilizing substances or tobacco or vaping devices while pregnant. And the last one is our physical health. So decreasing obesity, different initiatives that we've been working on, whether it's the Siouxland walking guide, or different all abilities coalitions that we've done to get people that may have a disability to be more physically active. Food insecurity, we've done, working with different food pantries on different toolkits there to get people to be donating healthy options, or different container gardening programs that have been held. So just a lot of things within of these coalitions that we've been working on that eventually will impact the health of our community. And again, a lot of that has been shared during our Growing Community Connections 5-minute health update. So this is just kind of the annual touch base of what they've been working on, to kind of show you now where the progress is that we've been hopefully making. So the next slide here shows our scorecard. And this is what we utilize for the Community Health Needs Assessment to show if we're making any progress. That baseline data there that was collected in 2021 at the end of the year, and kind of moving forward, is just like I said, it's the baseline data that we had access to. A year later now, in December of 2022, this was the most current data that we had for all of our indicators. Again, we have indicators for both of those 4, or all 4 of those sections: the mental health, the preventative health, the substance abuse, and the physical health. Ideally, we would love to have them all been green, but we do see that we still have some work to do. So those items in red, unfortunately, went the wrong direction. And so now we're going to be really focusing on what we can do to improve those, to get them to at least yellow or green. I do want to make note that a lot of this data may not just be from the past year. So even though we've been working on initiatives, this data may not reflect that, because the data always does take a few years to get. So we will be collecting data on these indicators for the next 2 years. Again, hopefully we will make progress by that 2024, that end of the health improvement cycle, that we can see a lot of green there. And then it will come time to reevaluate the needs in the community and potentially change up what focuses that we're looking on. But again, this is just kind of the annual recap to kind of show you what, if any, progress we made on some of the indicators regarding our health improvement plan. I do also just kind of want to summarize that all the work that's being done is being done through a variety of coalitions. And so you can kind of see them here on our screen, anywhere from the mental health roundtable to the STI coalition, and down the list. I also have provided the meeting contact person. So if you are interested in joining one of those coalitions, you've sat in on Growing Community Connections meeting, listened to that 5-minute health update, and thought, wow, I could really be a part of that, or our organization could be really contributing to that, go ahead and contact the meeting contact person so that you can find out the location and the time of these coalitions, because they each do have action plans that they are working on to ultimately address those indicators to make them all green. So again, this was just a brief annual update to kind of show you where we've progressed as a community, and hopefully next year I can come back and we'll have a lot more green in that 3rd column. So thanks again, everybody.